The single incident of the novel coronavirus in Nigeria is still sending shockwaves across the country, with concerned authorities giving Nigerians assurance that the situation is under control. Lagos State Governor Babajide Sanwo-Olu and his deputy, Obafemi Hamzat, were guests at the Emergency Operations Center in Yaba, where the COVID-19 isolation center is situated. The governor asked Lagosians to take more precautionary measures and upscale personal hygiene. Our correspondent, Chris Lems, reports.
An exchange of leg shake between Governor Sanwo-Olu, his deputy Hamzat, and the Commissioner for Health is a good way to begin this visit to the Public Health Emergency Operations Center at the Mainland Hospital, Yaba.
Thank you very, very much. Okay? Okay. Right.
He has come to see for himself the state of the facility at the center and get a progress report from the COVID-19 team made up of medical personnel from the state, federal government, international organizations, as well as some security agents.
Every state has an emergency operations center in Nigeria, and it is supported by the Nigerian Center for Disease Control. They, in fact, provided the furnishing and the electronics, and when they are well established, each state will be coordinated by digital connection and will be able to exchange information in real time and coordinate the response.
The governor and his deputy also get a taste of the personnel protection equipment.
There are also methods of removing it. Wearing it is one thing, removing it and removing it properly is another thing.
He's thereafter taken through the testing laboratory of the center. After the tour, the governor sums up his visit by applauding the dedication of the COVID-19 medical team and also calls on Lagosians to upscale their personal hygiene.
It's not when we have incidents like this or crises like this that we begin to learn how to wash our hands, how to keep a safe, secure environment, and how to live healthy. You know, it goes with everything. People that have developed immunity against these things are people that are continue to live well, eat well, and live in a very safe and secure environment.
On the index case, a 44-year-old Italian who fell ill while on a visit to Nigeria. The medical director of the Mainland Hospital says he's in a stable condition and making a lot of progress.
The index patient is on admission, is on medication, is getting well, is responding to treatment. His contacts have been dislined, and then they are in quarantine. There are people following them up to ensure that if they develop symptoms, they are brought into the facility and then a test is run on them. So for now, I think we are doing pretty well.
In the coming days, the governor hopes an awareness drive to get more Lagosians sensitized on how best to tackle the virus is intensified, while the medical team at the Emergency Operations Center continues to meet and put heads together on managing the index case in their custody. Chris Lems, Channels Television News.
Staying with precautionary measures, the Nigerian Civil Aviation Authority says it has activated all contingency plans for public health events in aviation, including airport-specific public health emergency contingency plans. NCAA Director General Captain Musa Nuhu says they've been working with the Federal Ministry of Health and other stakeholders in the aviation industry to ensure that all travelers coming into the country are adequately screened while causing minimum disruption to facilitation of travel. He advises airlines and other airport users to heed the guidance of Port Health Services on the use of screening forms, assessment of suspect or ill travelers, and any other measures they may adopt. He also asks airlines, airport operators, security agencies, and other aviation industry stakeholders to take appropriate precautions to protect their staff. Other state governments across the country are also bracing up and showing different levels of preparedness against the outbreak of the disease. Our next report highlights the various emergency mechanisms and response teams set up by state governments across the country.
43 persons, including 4 Chinese nationals, have been isolated in Wasi local government area of Plateau State in north-central Nigeria. They are undergoing medical attention and monitoring for any traces of the coronavirus.
For the contact tracing, we know we have drivers that convey these people from the airport to their site, mining site. These drivers were involved in the people that were being asked to stay isolated. Fortunately, it's just a short period, so they have not gone around to do any other thing. So the driver were also part of the people that being asked to stay isolated until the 10th or 11th of this month.
In the southeast, Governor Hope Uzodinma of Imo State has ordered the activation of all health platforms to protect Imo citizens against the dreaded disease.
Alhamdulillah, thank you very much, the Honorable Commissioner.
And in Kano State, the government is also taking proactive measures against the outbreak of the disease. The state government is asking citizens to use the existing emergency hotlines provided by the Ministry of Health to report suspected cases of the virus.
Kano State government has planned to further intensify COVID-19 surveillance in the state through engagement of traditional and religious institutions, training of health personnel at primary, secondary, and tertiary healthcare facilities, sensitization of traditional healers, production of and airing of jingles, and production and distribution of IEC materials, among other measures.
Elsewhere in Kaduna State, the Federal Ministry of Environment has flagged off the National Environmental Response Campaign to eradicate Lassa fever and coronavirus diseases. The ministry is appealing to Nigerians to maintain proper personal hygiene and keep their environment clean.
Make sure you wash your hands wherever you are, clean, and don't mix too much in certain places that you think you might be. Once you feel you are not safe, you will feel it, the instinct. Make sure you take care of yourself. That is what we will say for now.
Currently, there is no vaccine to prevent coronavirus disease, but the World Health Organization officials and health experts say swift response and effective actionable intervention are crucial in containing the virus from spreading.
Meanwhile, the president says he's concerned about the confirmation of a case of coronavirus in Lagos. President Muhammadu Buhari's worries contained in a statement in which he asked Nigerians not to panic, but to strictly observe the advisories disseminated by the Ministry of Health, the Nigeria Center for Disease Control, and the World Health Organization on the best ways to prevent the spread of infection. The president, however, commends the Federal Ministry of Health and other relevant agencies whose diligence and efficiency, he says, enable the case to be detected, diagnosed and isolated quickly, even while swift measures are taken to identify and follow up on those with whom the index patient came into contact. He also commended the responses of the Federal Ministry of Health and governments of Lagos and Ogun states, as well as other relevant agencies, to the reported incident and calls for vigilance on the part of citizens and responsible government agencies. Outside Nigeria, COVID-19 is still raging with more than 80,000 people globally sickened by the virus, which has killed more than 2,000. A leader of a religious sect in South Korea, Lee Man-hee, very likely will be facing a homicide investigation over some of the country's coronavirus deaths. The founder of the Shincheonji Church, Lee Man-hee, and 11 others are facing prosecution by the government, having been accused of hiding the names of some members as officials try to track patients before the virus spread. The Seoul city government filed the legal complaint to prosecutors against the 12 leaders of the sect, accusing them of homicide, causing harm, and violating the Infectious Disease and Control Act. It comes as the country confirms 586 more cases of COVID-19, raising the total number of infections to 3,736, by far the largest outside of China, and the death toll standing at 17. More than 80,000 people globally have been sickened by the virus, which has killed at least 2,991 people. As it's Sunday, the total number of confirmed cases on the Chinese mainland reached 79,824, and 2,870 have died of the disease. The total number of discharged patients amounted to 41,625. A number of countries outside China are reporting more confirmed cases, with some countries including Luxembourg and Ecuador reporting their first case of coronavirus on Saturday. Iran reported 978 confirmed cases of COVID-19 by Sunday, up 385 from the previous day, with 54 deaths and 175 cured. Over in Japan, 955 cases have been confirmed, with 705 of them from the virus-hit Diamond Princess cruise ship. A total of 12 deaths had been reported in the country, 6 from the Diamond Princess. Italy has been the hardest hit in Europe, with its confirmed cases of COVID-19 rising by 240 within 24 hours to reach 1,128 by 5 p.m. local time on Saturday. A total of 29 people have died of the disease in the country and 50 have recovered. The U.S. reported its first death of COVID-19 on Saturday, and by Sunday, the state of Rhode Island reported its first presumptive case was a male in his 40s who had returned from a trip to Europe, which includes time spent in Italy, Spain, and France. They say the patient is being treated at a hospital and that his immediate family members have been self-quarantining and had so far exhibited no symptoms of the disease. Britain has also announced a jump in coronavirus cases, with 12 new infections taking the total to 35, and Prime Minister Boris Johnson says he expects the number to rise further. In the meantime, France has announced 130 confirmed cases of the virus, while Peru and Colombia have been on alert since Brazil confirmed the first case in Latin America.